Hello, everyone. Welcome to today's Healthcare Digest video. I'm Mark Martin, a principal with the Mazars Healthcare Consulting Group, and today I'm joined by John Rowe and Tashonda Haugabrook of our consulting practice, who will be speaking on resilience in returning to work. John?
Thank you, Mark. Really appreciate it. And it's great to have the opportunity to speak about returning to work and not only returning to work, but resilience in returning to work, because at the end of the day, being able to have people perform effectively and continue doing business in our critical process is really broader than just where people work physically. Where we're at today, this is still a critical topic for most organizations and companies, because we've got some people, some organizations, especially in the manufacturing sector, that may never have stopped going into work and had to adapt very quickly to the changing environment. Some companies and organizations that we're familiar with have done a soft return to the workplace, leaving it up to the individuals as to whether or not they feel comfortable returning to the office or whether they continue to work remotely. But there's still a lot of companies and organizations out there that haven't really returned to work at all at this point and are planning and looking at potentially starting to return to their office and their physical work environments, later this year, especially, as the vaccine continues to be rolled out throughout the country. So it's still a timely topic and an important topic, as you'll see as we go through our presentation. So today we're going to talk a little bit about what's in it for you. Really, why is this important, and the types of risk and issues that you deal with that are important in assessing when to return to work and how to continue working effectively in the current and the ever-changing environment. We will talk about some key strategies and methodologies to address the risk and the concerns that folks may have in returning to work, as well as some of the technology considerations that are in play. And then we'll just briefly do a final wrap up as we close out the presentation. All right, Tashonda?
Thanks, John. As John and I have been working together doing this type of resilience planning for a few years now, and both of us in different capacities prior to that. And John, I don't know if you recall, I remember in November and December of 2019, just before the pandemic, we were sitting with a client and talking about their capabilities to work from home and their plans to be able to get back into the workspace. And so one thing I think is always really important when we get into this topic is to talk about what's in it for you. And specifically in the healthcare space, we found that return to work considerations, especially from the pandemic, have been completely different, because often the issues for returning to work have been revolving around you being required to stay open throughout this time. So when we're looking at how to apply these best practices in resilience planning and returning to work, one thing or some things you should consider are some of the expectations and limitations that have changed for your workplace. What have been the pain points? We know within the healthcare space, there's been a lot of staff shortages as the issue, but also just understanding at what capacity and what level are people allowed to return to work? Where are the liabilities there? And how am I assuring that I'm prepared for all of that? And then when we look at issues and risks to consider, a big thing that we're seeing come out of this already has been just this evolving compliance and regulation expectations, especially around healthcare service providers and the expectations for clinical professionals returning to work versus your administrative and other people. The things are different based on potential for exposure. And so being able to understand that and keep up with that, these are all things that are going to help you be more resilient in returning to work. And so as John and I talk through some of these different topic points, we really want you to consider where you've already been doing that. Maybe you've had to change the number of people allowed in an elevator. that in itself is just a completely different business practice and is going to, like I said, continue to evolve. Because what we know in our planning, our space of resilience planning, is that with disaster comes new legislation and regulation. So these things that you are already doing just to get by, at some point there will more than likely be a standard created that says this is what you have to do. And we put a few examples here just to kind of give an idea of what we mean. The first one is the Pandemic and All Hazards Preparedness Act, which was actually enacted in 2006, but then reauthorized in 2013. And this had to do with the inability to manage major disasters, post hurricanes, et cetera, with proper understanding and planning prior to. And it really, all three of these that we put here impact the healthcare space specifically, and how you operate and how you function and what compliance and regulations and rules are placed upon you on an annual, biannual, and so on basis. So consider the what's in it for me as we move along and get into how to actually return to work resiliently.
That's great, Tashonda. And actually, I do remember, it's interesting that you bring up 2019, because as I think back about it, we have been asking the questions, we've been helping organizations prepare for many years. If something were to occur, an event were to occur to where people could not physically come into the office or to the manufacturing facility, how would the business and how would the key processes continue? So it's similar planning that we've been doing for many years. However, I think the main difference is we didn't necessarily think that we'd be planning for people to have to work remotely and figure out how to get their work done for 12 months outside of the office. So that impacted a lot of the technology. I remember the specific discussions we were having about, well, if the systems are up, people can't get to the office, they can work from home, but we may not have enough active VPNs for people to do that. So there were lots of different little things that we had to consider, but this is not new. And this is why we talk about resilience and returning to work, because the issue of having to continue work in the event of a disruption has been around a while. The pandemic has just made it a little bit more unique, and the regulations that have existed and the new regulations that seem to change almost every day, as you mentioned, make it a little bit more complex. So with that, that rolls us right into, what do we have to consider? Where do you focus? And the simple answer is everywhere, but that's not very helpful, right? So let's talk about, people. I always like to start with people, because sometimes we forget about the impact to people and the stress in people's lives, and managing that so that people can continue to get their work done. People can continue to, manage their personal lives and their children and their families, which I can tell you from personal experience becomes much more challenging, in this day and age as well. So understanding people, understanding their needs and communicating with them, educating them, and just constantly reassuring them that they're going to be safe and that there's a good plan in place is really important, I think. And of course, processes, understanding the business processes that you need to keep operating down to clinical, et cetera. And then, of course, technology and facilities. So these, to some extent, go hand in hand. What are the physical facilities? What's the nature of the physical environment that people need to work in? This will drive a lot of the really bottom line strategies that you will have to implement, as you return to work, both now and in the future as things continue to change. Technology has been a critical component of allowing people to work remotely that did have the opportunity to do that, and making sure that technology is up and available and working effectively, 24/7. And the last thing, you never want to forget third parties. There are more and more these days. There are lots of third parties that we rely on to help us get through our day-to-day activities and meet our objectives from a business perspective. So you always need to think about third parties outside of your immediate environment that are important to helping you get things done and achieve your objectives on a day-to-day basis. what are some of the key considerations and mitigation strategies that we can employ in doing this? So again, these line up with the key risk areas and considerations that we have. And again, people, I think appropriately is first. But when I touched a little bit about training and education, I will combine that with communications. So people need to understand what the situation is. They need to understand expectations clearly and what the expected behaviors are clearly. That needs to be well documented and communicated consistently to all employees for there to be an effective program in place. Technology, continuous improvement of technology. I'm sure a lot of IT folks will appreciate this in this environment. You know, when things are working well, they tend not to hear a whole lot about it, right? But if people cannot get their work done because technology is down, they will certainly hear about it. So technology has been important, but it has become much more important, you know, in the last 12 to 18 months as we went through the pandemic. There are more basic things in returning to work in terms of personal protective equipment, pre-screening measures, et cetera, that need to be put in place. Tashonda talked a little bit about facilities. So depending on the nature of the facility, there's a broad range of things to consider. You know, if you have large office buildings where there's shared spaces, you have common areas where people are entering, you have the elevators, you have stairs, you have potential lunch rooms, you have potential gym facilities or fitness centers that need to be, considered in terms of when and how those can be reopened safely. And then you have much organizations with a much smaller offices that are a little bit easier to control, where you may only have 5 to 20 people in the office, at different points in time. But still, even within those, where you have shared spaces, kitchens, conference rooms, there needs to be a good strategy and plan put in place on how to effectively, be able to utilize those spaces safely. And again, things are changing and will continue to change as the vaccine gets rolled out and the general environment changes, especially from a regulatory perspective. But facilities are a significant part in the nature of those facilities and determining strategies for moving forward. What should you consider in planning? Again, it's going to touch on this. So governance, understanding what needs to be done, training and education. Simply put, what needs to be done initially is you need to understand where you need to be. You need to have a vision and a strategy. This is how we're going to work, at least for the meantime. You need to understand where you are, chart a clear path forward to get there, and then really monitor and continuously improve that plan, because things change quite rapidly, even in a normal environment. And there needs to be a way to effectively, evaluate how well policies and procedures are working and adjust those, as the environment and risk change that we need to address.
Yeah. John, before you move from that slide, I'm just thinking about, in our past efforts of actually building return to work plans for organizations since COVID, because everything is evolving, and you made that point several times, and I just wanted to reiterate it, because preparedness and planning really are our main focuses, and then continuous improvement is just as important. It's almost like they're a triad, because things are evolving constantly with this, and what's expected of you, especially as a healthcare service provider or a vendor or supplier, wherever you might fall in that realm, there are a lot more standards, hanging over your head that you have to abide by, and these types of plans help support you keeping up with that. So as we can move forward to the next slide, but we're now going to take planning and put that planning section that John just spoke to into action. How do we take all of these considerations for people and technology and facilities and all of these new protocols that maybe we've enacted across the organization, and how do we actually put that into a formal, documented a plan of action for your organization. And these elements that we're sharing here with you, they're applicable to larger organizations, smaller service providers, and like I said, even vendors and suppliers as well. We've come in and built this same type of, utilize these same elements in a return to work plan for life sciences organization, a large pharmaceutical company. So, you know, it is cross-functional, but consider as I speak to these different elements, what your role might be, who might be the key people, you know, how do we control and manage documents, who has to sign off on this for it to be formal and actually mean something, right? So beginning with the recovery teams, you have to identify who's going to be a part of this whole thing, who helps to build it, who helps to implement it, and who continuously improves it or just keeps up with maintaining your return to work plan. The first time that John and I did a speak on this topic was back in February. And during that time, I had just been tracking over the last 10 days. And in 10 days, there had been 8 different changes by the CDC guiding you on when clinical professionals could return to work versus other staff versus people who, you know, might work in a completely different realm. And all of this was based on which vaccine you had taken or not, and at what point you were in the stages of your vaccine. So if I've taken my first shot and I'm 4 days after that, I actually could not return to work at all until I've gotten my second shot as of February 16th. But by the 19th of February, that had all changed. So you want to think of people who are abreast with that type of information. You want to have someone like that a part of these recovery teams, but you also have to have someone who's involved with facilities management, someone who's involved with technology and making sure that your disaster recovery is up to par with your new needs for telework and telehealth support, et cetera. When you look at your protocols, there is a lot of guidance out there for us to help us understand what are the best ways to manage crowd control and ingress and egress into your facilities and out of your facilities. How should you manage social distancing and safety and containment control? What's the best way to set up lounge and eating areas for employees and staff? And then how are we doing health screening and wellness, not only of our employees, but of the various people that also have to access your facility? All of these things are good to consider and include in your return to work plan. When we talk about training, education, and outreach, there should definitely be a section that speaks to how you manage your people and their understanding. And that's when I say your people, I mean all stakeholders. So that's not just your employees. That may also be patients, that may be partners. There are various individuals that might have a role and need to have some understanding about the new protocols within your facility and how they impact them. So the ways that you get that information out, you want to have a section in your return to work plan that actually speaks to how you train, educate, and outreach to your stakeholders. But within that as well, it's also a good idea to speak to how you communicate with them in general. How are you getting employee feedback to make sure that those individuals that are on site and there on a daily basis understand the evolving guidance and expectations? And then mitigating workforce anxiety. Just too often in all preparedness plans and resilience plans, this particular topic doesn't get brought up enough, but we know caregiver fatigue is a real thing. And so, you know, making sure that you speak to managing that and keep that on the forefront of not only making sure your people can return to work safely, but that top management is behind this and supports us doing everything we can to mitigate workforce anxiety, especially during a time like this. Signage is also going to be key, and sometimes we'll do this in the form of, let's say, an appendix that just shows all the various types of signage that you're using around the facilities. And as well with that, there will be some description. So that'd be a great place to keep kind of a mass of all of the signs that you might use during this time. You'll find post-COVID, let's say there was a fire, during that time, that ingress and egress signage could be useful. Signage that you would use to say, hey, this area is being contained and non-accessible can be useful during other times. So remember that as you're building out your return to work plan, that those elements can be used in other situations. Returning to work is not only necessary post-COVID, and we know that, John and I, from the planning work that we've done in the past. But we're seeing now that it's just becoming more of a topic of concern for everyone. And then to just, again, that point about continuous improvement, the document management piece is going to help you there, because you're going to make sure that in this, my resilience and return to work is coming out in the vision and overall objective of this plan. We want to manage safe transitions to and from the workplace for everyone that may have to come in and out of this facility. We want to make sure that people who cannot come to work understand how they work from home and have the support that they need to do so. But also in this, version control is going to be so important. Like I made that point back in February, across 10 days, several different changes in just the guidance for how we come back into the workplace. So you're going to probably be updating this thing a lot as these regulations and guidance become formal, formal regulations, formal compliance for us. So actionable elements that you can take this as a checklist almost and begin drafting out what return to work looks like for your organization. And of course, if you need help, John and I were pretty good at it too. So when we talk about achieving resilience and returning to work, we cannot help but speak to resilience as a whole, because as we said, returning to work is something that you have to do in many different disastrous situations or hazardous situations. So overall organizational resilience planning is going to be key. And that is how you achieve true resilience and returning to work. I can smoothly transition regardless of what hazard has impacted my facilities, my people, my technology. So considering all of the things that John and I have spoken to as examples for preparedness considerations, planning considerations, assessing your capability in each of the areas that we've spoken to, and specifically to the areas you see over here in the house, will make sure that you have your house in order for a smooth transition to returning to work. And John, I know you always kind of bring up crisis management as a big overarching thing when we speak about this.
I do. Thank you, Sean. And even we can bring it to another level with enterprise risk management as well. But one of the things that's so important as we look at the types of things we're trying to address and the types of disruptions, the pandemic and others that we brought up, is being prepared. So the slide here really addresses that, right? Where are you today? You need an assessment. Where are we? Where do we need to be? And then chart the path to get there. And it's no longer really quite enough to say, oh, we think we're good, but you don't really know for sure whether you're good. And it's also not okay to say, oh, that could never happen, because I think we've all seen enough times now where the things that we thought could never happen have happened. And so really being proactive and understanding where you are and where you need to be to continue your organization and your company's mission on a day-to-day basis is very important to formalize that. So, and as we talk about the crisis management structure, where it starts from the top down, there are various structures that, depending on the size and the nature of the organization and the groups, can be effective. So, of course, for larger groups, you may have a much larger structure that's more formalized from the board down, with lots of other components that are involved across the board. Smaller organizations in general will have a smaller decision-making tree a straighter line in terms of communication potentially, so it can have a much different look in terms of a crisis management structure. But overall, the important concept to take away is that this crisis management, or even if you choose risk management structure, needs to be broad and encompassing, and really consider all of the different types of components of the programs that we've outlined, and all the different types of risks that could be incurred as we move forward, and have different types of things disrupt our organization and our day-to-day processes. So following the path, right? So we talked about enterprise risk management at the top down. Technology, we've pointed out, is very important, and especially remote working, maybe even process automation in some areas to be able to continue certain activities as things go. But one of the things that we like to touch on a couple of times, just to make sure you don't forget, is third parties. So dealing with vendors, dealing with third parties, even public-private relationships. There are many of those that we've been involved in helping, commercial and or private organizations coordinate and communicate with law enforcement, with local and state government, so that in the event something occurs, that there's an integrated, coordinated effort underway. So these are the types of things that need to be considered as you look at returning to work and just resilience overall.
Final piece, right? John, we talked through so many different topic areas, and I always love when we get to this piece about where to begin, because that's the question we always get. Well, where do I start? I can start with my facilities. I can start with this massive new technology needs and requirements that I don't understand. Where to start? We want to help you with that. This is really a good place to just start from here, because you've probably been doing something and you don't even realize it. You want to first conduct an assessment across the 4 key planning areas. So look to see where you have existing return to work protocols. And remember, a change in a facility's use expectation, only this many number of people allowed in the bathroom now. That's a new protocol for your workplace. But as well, if it's an understanding that prior to coming to work, you should check your temperature. You should go ahead and call in to, I know some larger medical systems have, or some of the larger hospital systems may have, a specific department that you would go through to get your COVID test at this point and confirm you're good or not. And that department is also tracking this and sending this information to HR, to your supervisor, to also say that person's not going to be in because they're at risk right now. And this is something that's found out prior to you ever coming into work. You're not even calling in to someone. That's a new protocol. So we want to look for all of where these types of protocols exist across that circle of mitigation areas that we spoke to some slides ago. You want to do an assessment of what type of training, education, and outreach that you're already doing. And then where are you lacking? In this, look back to some of the examples that we gave on the actual element slide of the plan. You want to think about those external considerations. So maybe that is other partners, maybe that's your vendors or suppliers. What are they doing to make sure that they're on top of safe transitions and returning to work, and that they're not having people who are not in the proper health returning to work and coming onto your work site? So those external considerations are going to be really important, and that can get a lot broader. The public and private partnerships that John spoke to. It's really useful to have some type of connection to public safety, to your health department, that is a direct in, because if things get, worse than they've been or get bad again, having that type of connection helps you to stay abreast of how you should be moving forward. And especially as a service provider, or if you're a vendor and supplier of, made things that are needed heavily within the healthcare space. And then do an assessment of what you do to continuously improve. And this is not just within returning to work. Maybe you have a project management or change management structure within your organization where you kind of already ensure continuous improvement of new initiatives. This would be a place to include or start a discussion around return to work planning and having an actual formal plan. And then here, within those key areas, these are some immediate actions you can take. For your people, and I would do this right away, survey your employees to evaluate their understanding of your return to work policies. And you want to do that on a regular basis. And yeah, people don't like surveys, right? So we like to get strategic about it. We'll say, maybe you're going to break it up and you're just going to ask 2 questions here and there, checking in with people. Did you know that so-and-so changed? You know, did you know that if you've gotten this specific vaccine, you actually only have to quarantine for 4 days at home? You know, do you have these types of did you knows even on your intranet can still be kind of getting that information out there and ensuring that your employees are getting some understanding, but you want to get that feedback from them to be sure that it's working. With technology, make a list of the technologies you rely on most. You know, we like to call it a critical applications and service list, or a castle. You know, so you have the keys to your castle when you have that list, ultimately. But at this point, your list may have changed, and you may have some new technology vendors. You may find that you need to reevaluate some of your current contracts. Just taking a note of that and looking at where you stand is going to help you moving forward. And then you want to look into seeing where you stand with disaster recovery planning. Do you have an enterprise disaster recovery plan? Do you have plans to recover those critical systems and applications that we were talking about just before? With enterprise risk management, you want to start being proactive against your risks, not just pandemic related risks, not just the return to work risks that stand out to us today, right? But do you understand all of your key risks across your organization? It's going to be key. And then having return to work discussions, planning discussions at the enterprise level. And crisis management planning discussions at the enterprise level, just in general, making that a recurring agenda topic is going to build resilience across your organization. With legal and regulatory, this one is really important. And we mentioned some key regulations that have come up in the past that have really just kind of changed how healthcare organizations operate. But one that I'm even taking note of today, the emergency preparedness rule, the CMS emergency preparedness rule that allows for you to receive, Medicaid, Medicare payment. This is going to change that entire rule a lot. And every time there's a major disaster since that rule was enacted in 2016, that is exactly what happens. There's a new evolution and understanding, and we say you need to do this much more planning and preparedness activity. You need to document it. You need to do test training and exercises. You need to do a full-scale exercise on a biannual basis if you provide any of these types of services that fall in one of these areas, or if you're one of 17 different service provider types, you have to adhere to that rule. So knowing what the legal and regulatory is, not just the CDC says this is what you should do, but what is going to put you in a legal or regulatory bound bad place, be ahead of that. Get ahead of that as much as you can. And just looking in these areas is going to be helpful with that. And the last area we speak to is communication strategy. Reviewing your existing communication channels, making sure you have backups for that. If we're still depending upon a call tree in such a virtual space, we definitely need a backup of how we communicate with one another. And so as you're building out that return to work plan, and the team that's a part of that can definitely help to drive new communication strategies that you employ across your organization. So we've given a lot here, John.
Yeah, we have.
Too much?
I think it was great. So what I'll do in close, I some wonderful points that you bring up, Tashonda. And one thing that I want folks to walk away with is this. We've talked about a lot of stuff, right? And as you said, Tashonda, it can seem overwhelming. So, one thing to remember is just get started. It's like having a to-do list here at home, right? If I look at my to-do list or my to-do list at work and I've got 40 things on it, it seems overwhelming. If I just take the simplest one and I just knock that off and I'm done with it, I feel better, right? So what I would recommend is just get started. Pick a few areas, a few places within this. You can do assessments or you can make decisions and make improvements, and just start and follow that continuous improvement kind of thought process. Don't let perfect be, the prevention of good, right? I don't think I said that exactly the way I wanted, but conceptually speaking, just get started. And as you start to knock this out, you will get a plan in place and you have a way to monitor it and continuous improvement. But there is a need to get started and to make sure that this is something that is addressed, throughout all of our organizations, at this point. And of course, if anyone has any questions or comments, feel free to reach out to Tashonda or myself, and we'd be happy to speak with you.
Yep. Or just connect with us on LinkedIn. We're always looking to make a new friend.